Okay, now we're going to show you what amalgam number 2 for skills would be. The difference between 1 and 2 is that we're going to use a matrix band. So that means the filling is going to be including either mesial or distal of the tooth. So it could be number 30 MOD. So first step is going to be the mirror. We're always going to give that first. The dentist will keep that in their hands. And then we want the explorer so we can verify that we're working on the right tooth. Next step is to get the patient numb. We'll use the topical anesthetic on the cotton tip applicator. That is like a jelly that goes on their gum tissue. And then we'll use the aspirating syringe. And again, if it's a blue needle, we are going to be working on the maxillary. If we were working on anything on the mandibular, we would use the yellow needle. After about 10 minutes, they're going to be numb. We're going to come back and we're going to use the high-speed, slow speed hand pieces. The assistant will use the HVE the whole time. That's because the high speed has water coming out of it and the slow speed is going to be flaking out decay, and so you're going to need to use that HVE to get it out of their mouth. Then we are going to use the spoon excavator. That looks like a little spoon. It's double-ended, and we're going to use that because it's going to remove any excess decay. You will actually be able to kind of scoop it out. And then depending on where we're working will depend on the next instrument. If we're working on a maxillary tooth, we're going to use the chisel. Notice how straight and long that one is. That's going to be what's used to make the undercuts. So chisel is for maxillary. If we're working on a mandibular tooth, then we're going to use the hatchet. It is bent. So again, that's a mandibular. Now, we need to put that matrix band on, and so that's what you're going to pass next. So that would be around the tooth already, and if you watch the video so you know how to set that up, but that is going to be passed to the dentist in the right position. Then we're going to use varnish, liner, or base. The varnish is the one that smells like nail polish remover. You're going to put that disposable microbrush into the varnish, and if the filling gets deeper, that's when we might use a liner or a base, and that's a two-part system. You put equal amounts on that pad of paper, and you would just use that blue microbrush to mix it up and give that to the dentist. Now we would be mixing the amalgam in the amalgamator. We're going to place it in the amalgam well, and then we're going to pack it into the amalgam carrier. You would do both ends of it. You pass that to the dentist, and then you're going to pass them the plugger. Plugger looks like a little hammer. It is two-sided. One side is bigger than the other. You always want to start with the smaller size. And give it to the dentist in the right position. You want to have it facing up if you're working on the maxillary and facing down if you're working on the mandibular. Now, the next carving instrument is going to be the discoid cleoid. And you have to look up really close. You can see that one end looks like a leaf and one end looks like a spoon, just like the spoon excavator. When we're using the discoid cleoid, the assistant would need to have the HVE because they're flaking that amalgam out. Now we want to put some anatomy back into the tooth. So we're going to use the anatomical burnisher. Again, it has a little point in it. There's double-sided. One end is smaller than the other. We're always going to start with the smaller end first. And then we have the ball burnisher. That one just looks like a little ball on the end. Again, double-sided. One end is bigger than the other. Now, because we have that matrix band on, when we've used that ball burnisher, we are essentially pushing that amalgam around where that band is. So now you need to pass the explorer back to the dentist. And they're going to take that and go around where that band is and just make sure all the loose amalgam is off of it. Then you take the explorer back, and the dentist is going to be removing that band, okay? And then you're going to be passing cotton pliers because now they have to very carefully remove the band. They'll take that band out of the holder, and you're going to pinky grab the holder while you give the cotton pliers. Now that the band is off, we can check the bite. So we need the articulating paper holder. If it's high, just like in Skills 1, you will use the discoid cleoid again. And if we've tested it once, we know we have to check the bite again, so you'll pass the articulating paper holder again. If it's all good, now we're going to use that wet cotton roll. The dentist will wipe off the tooth they just worked on, and then the assistant will give a final rinse. And the same instructions to the patient are don't eat on that side for 24 hours because that amalgam is not hard yet.